Obesity is a medical condition in which an individual's body weight is substantially greater than what is considered healthy for their height. The condition is measured using body mass index, BMI, which is calculated by dividing an individual's weight in kilograms by the square of their height in meters. A BMI of 30 or higher is considered obese. Prevalence. The prevalence of obesity has been steadily increasing over the past few decades, with the World Health Organization, WHO, estimating that around 13% of the global population was obese in 2016. In the United States, the prevalence of obesity has increased from around 15% in the 1970s to over 40% in recent years, making it a major public health concern. Complications. Obesity is associated with a number of serious health problems, including an increased risk of cardiovascular disease, type 2 diabetes, high blood pressure, and certain types of cancer. It can also lead to psychological problems, such as low self-esteem and depression, as well as physical disabilities that can limit an individual's mobility. Contributing factors. There are a number of factors that contribute to the development of obesity, including genetic, environmental, and behavioral factors. Some of the most important environmental factors that contribute to obesity include the availability and affordability of unhealthy foods, the prevalence of sedentary lifestyles, and the lack of access to healthy food options and physical activity opportunities in certain areas. Behavioral factors that can contribute to obesity include overeating, consuming high-calorie foods and beverages, and not engaging in regular physical activity. In some cases, medical conditions, such as hypothyroidism or Cushing's syndrome, can contribute to obesity, but these cases are relatively rare. Prevention. Obesity can be prevented and treated through a combination of lifestyle changes and medical interventions. Lifestyle changes that can help prevent and treat obesity include adopting a healthy diet, increasing physical activity, and reducing sedentary behavior. Medical interventions that can be used to treat obesity include prescription medications, bariatric surgery, and other weight loss procedures. One of the most important factors in preventing and treating obesity is making healthy choices a part of daily life. This includes choosing to eat a healthy diet that is rich in fruits, vegetables, lean protein, and whole grains, and reducing the consumption of processed and high-calorie foods. Regular exercise is also essential, as it helps to burn calories, build muscle, and improve overall health. In addition to lifestyle changes, there are a number of medical interventions that can be used to treat obesity. These include prescription medications that can help to reduce appetite or block the absorption of fat, as well as weight loss procedures such as gastric bypass surgery or gastric banding. Medication and treatment. While these interventions can be effective in treating obesity, they are not without risks. Some weight loss medications can cause side effects such as nausea, diarrhea, and constipation, while weight loss surgery can lead to complications such as infections, blood clots, and nutritional deficiencies. As such, these interventions should only be used under the guidance of a qualified healthcare professional. Conclusion. In conclusion, Obesity is a major public health concern that can lead to a number of serious health problems. While the prevalence of obesity is increasing worldwide, it can be prevented and treated through a combination of lifestyle changes and medical interventions. By making healthy choices a part of daily life and seeking medical care when necessary, individuals can reduce their risk of obesity and its associated health problems. If you liked the video, like, comment and share. For more videos, please subscribe a Nature Fella.